Hi, my name is Geraldine Strathdee. I'm the National Clinical Director for Mental Health. What progress have we made? Well, in the last year, we've had really amazing progress in terms of mental health at national level. We have really significant increase in public across the whole country interested in mental health, asking us to help them understand more about who gets mental health problems, what are the kind of really effective treatments we've got, what services are available, demystifying the thought that mental health is something really frightening and scary. In NHS England, we've had terrific progress in terms of our NHS Choices website. We've got great user co-produced, so people coming forward, telling their story, talking about their condition, talking about the treatments they had, about how they worked together with other people with the same condition in a peer support group, how they've managed their own conditions, and what kind of services they find really helpful. That programme of making sure that we have made available to the public information on all mental health conditions and treatments and services is really progressing at a fantastic pace. And I know that Helen Roundtree and the team in NHS Choices have a big plan on that. So that's gone really well. The second thing that has gone very, very well is the great interest inside NHS England on helping the mental health world get the kind of information systems in place that will help us deliver safer care to our patients. So although in mental health we use great electronic care records, what we've not been able to do yet is have them linked up to systems that give better support to service users, like apps, like online tools, been able to send people text reminders for their appointments. We've been able to make sure we get people's blood tests done and get the results back to them quickly. That's all work that we've really clearly identified needs progress on, and we have the support of Beverly Bryant and Tim Kelsey and their teams to progress that. You also may have seen yesterday we launched the Mental Health Online Apps Library. So able to bring to the public the knowledge that people don't always have to leave their home to go to an appointment. For people that want to use that facility, we've got online treatments and therapies. And again, that's just the beginning of a journey to look at how do we use the digital world to bring more knowledge to people, to help them be real equal partners in their care, to help them use tools to self-manage, and also to have more easy contact with mental health services. We've launched the My NHS website, which also has information on secondary care mental health services, and we've started to be able to separate out the information we've got so that if you are a person living in an area with psychosis or eating disorders or perinatal conditions or depression and anxiety, you can see what that service is going to be like for you. Because I think sometimes people think that you want to know about your local trust or your local organisation. And actually our finding is that what people want to know about is, if I have this particular kind of difficulty and challenge, what's the service like for people like me? What's it like? So that's another programme that's kind of bubbling along. We've had, I suppose, one of the most fabulous things we've had is the Crisis Concordat Strategic Clinical Networks, Academic Health Science Networks partnerships. So all across the country, and I mean all across the country, in every single area, we have the launch of Crisis Concordat. So that's 22 partners in each area coming together to look at what do we do to end this dreadful mismatch of crisis services for people with mental ill health. So I'm never in rooms with less than 300 people. Could be police officers, fire chiefs, school teachers, GPs, experts by experience, third sector, our mental health organisations, commissioners, a whole enormous range of people come together and actually talk about how do we get a single point of access, a single number people can ring behind which they rapidly can get the help they need with really well-trained mental health assessments. Again, we've had superb help from Deborah El Said and the 111 team in terms of really now looking at developing great directories of services of what each person can access in the local area. We've seen a great growth. So we now have 24, they're called street triage services. So that's where the police may see someone in the street that they're worried might have a mental health difficulty or a learning disability or in some way be very disadvantaged. And they now have set up systems that they have direct access to mental health professionals. So that is having an enormous benefit in the areas where it's been going a bit longer in reducing by far the number of people going to police cells. So our commitment is to reduce in the next year that no child, no young person will go to a police cell as a place of safety unless there's some major difficult risk situation. But we also want to really try to get the rest of the country to the level of progress that London's made. So in London we used to have 800 people a year being brought to police cells for an assessment in crisis. This year we've only had 20 for the whole of the capital city in this country. And we know that police forces all across England are making great efforts to work, and so are the mental health trusts, to work in really close partnerships so that we together we solve the problem of kind of what's happening for people. We've done, I think, beyond our wildest expectations, we have seen just a great focus on children and young people's mental health, a real understanding about the need to help educate in schools, school governors, the boards of schools, in the universities, in the colleges, in young people's employment, in the forums where we find young people, communities where there may be gangs and so on, to help them understand that much mental ill health is preventable if we put in place systems to help people understand how to avoid mental ill health, how to build their own resilience to kind of deal with the things that people put to you. And we now have growing we've had the Pan-Government Commission, now looking at things like how do we aim as a society to really maximise the prevention of childhood physical, sexual and emotional abuse. How do we reduce the amazing amount of alcohol that kind of is drunk around the country that leads to so much kind of people presenting with trauma, going to A&E, etc. We've very successfully got some excellent pathways for people with eating disorders, for women in the perinatal stage of mental health, and we've got some new access and weights standards. So the standards that we are now putting in place for people with psychosis, for people with eating disorders, for people with perinatal conditions, will mean that people get access to the care they need very rapidly, and the care they get will be excellent and in line with NICE guidelines and expert by experience advice to us, and that outcomes will be measured, because we really want to make sure that we give the best value for money. And absolutely finally, we have trained 150 new CCG mental health leaders and champions across the country. And so we're now starting to get the plans to absolutely maximise the consultations with them, maximise their input, expose them to the Citizens' Assembly, and really help them see the great amount of good practice we've got across the country, and find the answer to probably one of the thorniest questions. How do we spread the good practice everywhere? Because it's so much of it, but it's in pockets. And how do we train the workforce, our mental health workforce that has not had a huge amount of support in the past, to develop all the skills, the transformational skills that they will need to deliver the really good, effective, evidence-based guidelines. And I could go on for another few hours, but we're exhausted.